Welcome to this video on pediatric nursing, focusing on the Gomez classification for protein energy malnutrition, or PEM. This guide is designed to help you understand this critical classification system. PEM is a group of pathological conditions resulting from a deficiency in protein and energy or calories. The two severe forms are kwashiorkor, which is protein deficiency leading to edema, and marasmus, which is calorie deficiency leading to wasting. PEM is the leading cause of child morbidity and mortality in developing countries. Classifications like Gomez are essential tools for health workers to assess severity, plan appropriate treatment, and monitor a child's growth over time. The Gomez classification, developed by Mexican pediatrician Dr. Federico Gomez in 1955, was one of the first standardized methods to quantify malnutrition severity based on weight. The Gomez classification uses only one parameter, weight for age. This compares the child's current weight to the expected weight of a healthy child of the same age. To calculate the expected weight, Gomez used the 50th percentile of the Harvard standards, also known as the Boston standards, as the reference for 100% or normal weight. The calculation formula for nutritional status is the child's current weight divided by the normal weight for their age, multiplied by 100. For instance, if a 1-year-old weighs 7 kilograms but the standard weight is 10 kilograms, the calculation is 7 divided by 10 times 100, which equals 70%. In another example, a 3-year-old weighing 12 kilograms against a standard of 14.5 kilograms results in 82.7%. We will now see how these percentages are graded. The Gomez classification is divided into categories based on the calculated percentage of expected weight. A child is classified as normal if their weight is greater than 90% of the reference standard, indicating adequate nutrition. No intervention is needed, other than maintaining the current healthy diet. Grade 1, or mild malnutrition, falls between 75% and 90%. The child is usually asymptomatic and is managed at home with nutritional counseling for the parents. Our second example of 82.7% falls into this grade. Grade 2, or moderate malnutrition, ranges from 60% to 74%. Visible wasting may begin, and the child's immune system may weaken. Management includes supplementary feeding and close monitoring, often in a community center. Our first example of 70% falls into this grade. Grade 3, or severe malnutrition, is classified as less than 60%. This is a medical emergency requiring hospitalization due to severe wasting, muscle atrophy, and a high risk of complications. When visualizing these zones on a growth chart, the green zone represents normal. The yellow zone often combines grade 1 and 2, and the red zone represents severe malnutrition, typically grade 3 or IV. To review some key points, Dr. Federico Gomez developed the classification. Grade 3 is less than 60% of expected weight, and the parameter ignored by Gomez is height and edema. The popularity of the Gomez classification stems from its simplicity and ease of use for early diagnosis and longitudinal monitoring using growth charts. A key disadvantage of Gomez is its reliance on the exact age of the child, which can be inaccurate. Furthermore, since it uses weight for age, it cannot distinguish between acute wasting and chronic stunting. Crucially, Gomez ignores clinical signs like edema. In severe kwashiorkor, fluid accumulation adds weight, which may falsely classify a severely malnourished child into a less severe category. The Indian Academy of Pediatrics, or IAP, modified Gomez by introducing 4 grades. The IAP normal starts at greater than 80% compared to greater than 90% in Gomez. This table shows the difference between the Gomez and IAP classification grades based on the percentage of expected weight for age. The Wellcome Trust classification was introduced to fix the edema problem of Gomez by including edema as a parameter for assessment. Waterlow addressed the age dependency flaw of Gomez by using weight for height to measure acute wasting and height for age to measure chronic stunting. The IAP classification defines grade 4 malnutrition, while the Wellcome Trust classification includes edema. Waterlow is used to measure stunting, and in IAP, grade 1 starts at 71%. In a calculation challenge, a 2-year-old child weighing 8 kilograms against an expected weight of 12 kilograms is 66.6%. This falls within the 60% to 74% range, corresponding to grade 2. Gomez classification is based exclusively on weight for age. Weight for height and height for age are parameters used in the Waterlow classification. In Gomez classification, Malnutrition is considered severe or third degree when weight for age is less than 60%. A major limitation of Gomez classification is that it does not distinguish between kwashiorkor and marasmus because it ignores the edema present in kwashiorkor. The reference standard used in Gomez classification is the Harvard standards, specifically the 50th percentile. Accurate assessment is crucial. Nursing responsibilities include correct weighing, verifying the child's age, and accurately plotting the data on the growth chart. Nurses must provide health education to parents on key topics, such as exclusive breastfeeding, starting complementary feeding at 6 months, and maintaining hygiene to prevent illness. Management for grade 1 and 2 malnutrition occurs at home or in the community. Interventions include dietary supplementation, education on calorie-dense foods, and monthly follow-up. Grade 3 management requires hospitalization, often in a nutrition rehabilitation center, to treat complications, administer therapeutic milk formulas like F75 and F100, and provide essential multivitamins. Dietary management for children with PEM aims for catch-up growth. The rule of thumb is to start low and go slow to avoid refeeding syndrome. Prevention involves primary measures like maternal nutrition and promoting breastfeeding. Secondary prevention includes growth monitoring using charts like Gomez and the early detection and treatment of infection. In India, the Integrated Child Development Services (ICDS) scheme uses classifications like Gomez for growth monitoring, providing supplementary nutrition, and referring severely malnourished children for care. To summarize, Gomez uses weight for age, with grade 3 being less than 60%. Its major flaw is ignoring edema and height, and the reference standard is the Harvard standards. Thank you for watching this video. The next slides include contact information for the presenter.